All right, welcome everybody. I'd like to call this meeting to order. Thank you all for being here. Thank you, Dr. Fox, for being here. First item on the agenda is the adoption of the agenda. Can I get a motion for the agenda?
Sorry, go ahead.
I was gonna say, I'd like to move to amend the agenda to remove or table 2312, 2313, and 2314 from the agenda.
We have a motion. Do we have a second?
Second.
Any discussion? Michelle, you need a minute?
No, I'm good, thank you.
Did you hear the motion?
Yes, I did.
All those in favor say aye.
I
Opposed? Motion carried. Would you like to? So you go ahead.
What is, can I ask a quick point of information? If we don't discuss that tonight, is there anything in danger, like in the between, can I please get information?
My understanding, no, there's nothing in danger of any deadlines being missed, but
yeah, that's what
Amy,
yes.
My understanding from Amy was that those were the ones that were not immediately needed.
However, I was mistaken.
So
2312. If that one could be heard today in place of 2308, if we want to keep it at just 4, 2312 needs appropriation through the council, and they won't do that until Board of Health approval. And that grant is currently underway, so we're not receiving any reimbursements for the work that we've been doing for weeks.
hate to ask this, but I thought we were just approving the application. And then so the commissioners could sign off and it could proceed, no?
Well, state law doesn't require you to approve the application, it's just to receive funds, so.
correct. The commissioners are asking us to approve the applications, apparently. State law, we are required to approve receiving funds. So we have to do the latter. The first is apparently.
But 2312 is one where we're engaged in the work. We can appropriate funds for the work we've been doing. If you all will approve it, so we could go to council for appropriation. So it would be to our benefits to be able to recover that funding.
We've just approved an agenda without that item on here.
Can I make a motion to reevaluate the agenda
Yes.
to potentially include 2312, please, based on the urgency that's being stated?
Can make any motion you like, right?
Please, okay.
There's a second to that?
Second, is that to discuss it, I guess? Okay, yes, we'll second.
Discussion?
I guess the one question, part of the reason why we're taking these off the agenda is because these seem to be bigger grants that we haven't had a lot of time to discuss. So I guess my question right now is if it's a matter of, and wait a second. Should I be talking about, should I be talking about the substantive questions about, I guess the question I have is over if we don't address it now, we address it in 2 weeks, which I think would be the next time. I mean, how realistically, does that just mean that does that affect the reimbursement process? I mean, does it mean that we don't get the money, or does it just mean that the money is going to come 2 weeks later?
For the ones for 2308, 13 and 14, if those were to be postponed, those funds have already been appropriated and are currently what I call active. So I don't need any action from council on those because those have been appropriated prior to it being brought to our attention that we need approval from the Board of Health. I'm just going through and trying to get every grant we have through you guys approved, either to apply for it if it is something that we are applying for, or to be able to receive funds. That's what I'm not clear on. At what point do we want to do it? At the very beginning when we're applying and therefore receiving the funds then would be implied, or do we need to come back for approval for that?
What does the law say? Do you know?
Yes.
Okay. I'd love to hear it.
Easy question. So the law says that you, the Board of Health, must accept a grant after it has been approved or funded. So the department applies for the grant. The grant is approved and the agency or the funding entity is willing to fund us. The board must approve it before the department can accept it. That is what is legally required. The commissioners have recently stated that they are not going to sign off on the applications for the grants unless the board approves them. Because they don't want, my understanding is they don't want the department to do a bunch of work for a grant that has no chance of actually getting funded. Because, and the department can speak to this more than I can, but my understanding is applying for grants is a lot of work. So they don't want the department's resources to be wasted going after things that are not going to be approved.
Seems reasonable.
Do we know what the guidelines are? Like, what are so that people know whether or not to even apply for a grant? Like, that's my question is, what are the guidelines or what guidelines do we need to be looking? I don't know what I'm looking for. I feel like I'm on a hide and seek mission, but I don't know what I'm looking for.
There are no guidelines. I think that it would behoove some of the board members to get with the commissioners and or the council and have a conversation about what they're looking for. And that would give you guys guidance, which in turn could be given to the department.
Can I ask another question?
Yes, many as you want.
So is it just the Board of Health, the Department of Health that's kind of under the microscope, right? I'm trying to figure out. I feel like there's a target.
Well, there
over
are
that.
not a lot of departments under state law where the boards have to approve the funds before they can actually be received. That's an interesting little thing for departments of health. So since you have to approve the funds, they to receive them, the board should also, once again, I don't think that these folks want to be wasting their time chasing after grants that you guys are not going to ultimately approve. It doesn't make any sense.
Well, but it's not just about us, it's also about the commissioners, right?
The council.
The councilors or whoever.
commissioners, Yeah. 'cause-
Who are we responsible to? You said the commissioners want to accept it. Do you mean the commissioners or the
So
council?
the commissioners have to sign off on applying for the grants. The council ultimately appropriates funds. So if the council, so we've got like a two-step process here in St. Joe County. So if the council ends up not appropriating the funds, then even though we applied for the grant and we got the grant, the money will never actually be released.
So it's two groups of people we have to satisfy. I'm just trying to
Well,
understand.
we as the department, it's actually three. It's the board, it's the commissioners and the council.
So the commissioners have to sign off on the grants, more or less.
Applying.
The
Applying for them.
applications, they sign the applications.
Okay, and then the council has to sign off on appropriating the funds.
They appropriate.
And then does it go back to the commissioners then after that, after the appropriation of funds?
So. the
Yeah,
commission-
it does.
Yes, it does, because that's where the council overrode the commissioner veto last year.
Okay.
So the appropriation has to be approved by the.
Well, that's right, because the commissioners are the ones who actually say what money gets used. Yeah.
So does the council approve appropriations and the commissioners approve appropriations?
Technically, the council just does the appropriation. The commissioners are the ones who are, they're like the executive branch. So they're the ones who say what programs are actually going to run in the county. So it's the way, like, if you go back to your high school civics, right? The council is like Congress. They're supposed to say this is the money we've got and this is how you can spend it. And then the commissioners are like the president and the executive branch, and they say, okay, this is the pot of money we've got. These are different buckets we want to fund with it. We want to use it for.
Any other discussion on the motion to add 2312 back to the agenda?
Is there a reason not to?
One of the reasons I didn't study that one because.
Yeah, that would be the same reason for me. Like, I just, I did a little. And I just realized that there's more that we probably needed to look into, just to figure out what's going on. That I haven't been able to do since Monday night. So, yeah,
Other discussion, then I'll call for a vote.
yeah, because we're gonna have to approve it eventually. It's just a matter of now or in 2 weeks. I think that's the issue.
Yeah, do we lose anything by approving it today? That's my question.
Honestly, we wouldn't, because the next committee meeting for the council is March 28th. So as long as it is on the 15th agenda for the Board of Health and action is taking to move it forward, it would make it on the council committee agenda.
So we don't have to do something with it today to get it. It's not imperative that something be done with it today.
Right, because council's not going to meet before.
Okay, all right. That's really, I just didn't want to leave you guys hanging.
Which is the
basically.
whole reason we're having this meeting. No,
We're trying to get that things that we need to, that you're gonna be left hanging with.
Well,
today.
and the thing is, I think what Amy mentioned is an important component. I didn't realize that this is funding, this is work that's already been done. So I think that's what we, getting more of an explanation for the next 2 weeks over what that means will be.
Okay.
So,
So on the motion to add agenda item 2312 back to on the agenda, I'll call for vote on that motion. All those in favor say aye. Opposed, say nay.
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 Okay.
So it'll be the March 15th agenda.
We'll be on the March 15th agenda.
Okay.
All right, moving on to approval of grants 2308. Discussion or want to entertain a motion or ask for any?
Oh, I do. I have just a couple of questions. So 2308 and 2309 is wait, this is discussion time, right? Okay. Is this the same grant, but just different grant years?
Effectively, yes, it's the
Okay.
same RFP that comes up every year
Okay,
to support the immunization clinic. 2308 has already been appropriated for
Okay.
the current fiscal year, and then 2309 is an application that will be for next fiscal year.
so July 1st or something. Okay, all right. So basically, the reason why there's two is because we're just getting our ducks in a row with the current one.
Right.
And then this.
Already applied for, received the funding, and it's been appropriated.
Okay,
It will warm the cockles of Marcel's heart to be able to say that we have complied with that requirement under Indiana code.
lawyers love confinement statutes. So, okay. And then how, I'm just curious, I didn't see it. How much is it for? And then it just, how much is the yearly grant for?
176,000, no. How much?
2308 was 272 or something.
For the current, current cycle that we're in now,
Okay.
for the 2022, 2023.
It supports our mobile immunization team primarily. And so
Okay.
the increase, we'd usually been, 175-ish. We added our immunization outreach coordinator between those fiscal years to increase our outreach, especially to the school corporations,
Okay.
to improve it, kind of emerging from the pandemic to improve compliance with Department of Education requirements for vaccines for school-age children. So we have spent a lot of time in this grant cycle working with the schools to provide outreach clinics and take our mobile team to the school.
And you said that's required by the Department of Education?
Yeah, so it's focused on the Department of Education, the state mandated immunizations for school-age children.
Okay. Now, wait, so are we, last year, did you use it, you said for the mobile clinic?
Yeah,
Does it help support like the actual unit?
the unit,
Maintaining
and
it?
we have we have 2 part-time nurses, 2 part-time registrars, and then our immunization outreach coordinator that are funded on this. grant.
Okay, so it's like salary offsets for them. Okay. And then this time it says capital costs, 2 Vax fridges and 2 Vax freezers. Is that just
Yes,
money that
we,
we're gonna?
a lot of our equipment is nearing life cycle for vaccine refrigerators and freezers. And so our grant application, the increase between our current fiscal year and next year is funding to replace some of that equipment.
Okay, okay.
If we can do it on grant dollars rather than out of, money in reserve or whatever. all
State
the
pot
better.
versus
So,
local pot, huh?
because we are at life cycle on that equipment. We had one unit fail here recently and had to repair it. So,
Did you lose anything? Anything that was stored in there?
I mean, we.
we were able to move it to other units until that got repaired.
Any other discussion? All those in favor say aye.
Who made the motion?
Wait. What?
Oh, was there not a motion?
To accept.
There was no motion, I'm sorry.
Or did you have a motion when you say?
No, I'm good.
I move to accept the grants 2308 and 2309.
Second.
Motion and a second. Any further discussion?
No, my questions were answered.
All right, all those in favor say aye.
Aye.
Opposed, say nay. Ayes have it. Item 2310, Public Health Emergency Preparedness Budget, period 5.
So this is open for discussion.
Open
Okay.
discussion. Make a motion.
Okay, so this one, I was curious, I just didn't see how much it was for. And 25, okay, and what exactly is the money gonna be used for?
So we use the money actually on different things. In the past, it actually has often been used to pay for maintenance for the emergency response vehicles,
Okay,
which are our mobile clinics that our immunization team uses in non-emergency scenarios.
okay,
But we can also use it to get personal protective equipment and other resources. My hope this year is to use hopefully not to have to spend it on lots of maintenance for the emergency response vehicles, because we did just get a new one. We're still kind of going through growing pains with it a little bit. But I would like to use it more so for PPE and for helping out different departments, getting like first aid kits for our nurses, things like that.
okay, okay. Okay,
Any further discussion?
that's my question.
Entertain a motion.
I move to accept grant number 2310, period 5.
Second.
Motion and second. Any further discussion? Comment?
Nope.
All those in favor say aye.
Aye.
Opposed, nay. Carries. 2311, sponsorship from St. Joe Health System. Discussion or want to make a motion?
So the sponsorship, is this, so I guess it sounds like it's a 2-day event in kind of different parts. Is that,
I mean,
Oh.
what we're doing is one event.
okay, that's what I wondered. So is this just for the May 4th, the evening event? Okay, and then there's a May 5th event, but is the health department sponsoring that? Okay.
That's mental health in Michiana.
Okay, okay. And
There's
this,
a little overlap because
yeah, they're related. Okay, and it's
the
all,
speaker's gonna do both.
okay,
Yeah.
and it's all set at Notre Dame, correct?
The one that we're involved in as far as the logistics and everything is at Notre Dame.
Okay.
At the Compton at O'Brien's, and then the one that MHAM for short is that's at the library. But they're gonna have multiple rooms and.
Oh, okay. And are there any speakers besides Dr. I can't remember my own writing.
Arnado.
Arnado.
Yeah, so at our event, I will share some data and how we, arrived at having the meeting because, or wanting to have this event because of the, presence of maternal mental health issues. And then Lisa Kelly from Mental Health Awareness Michiana, who's a social worker and her area of expertise is perinatal mental health.
And then Jennifer Carter, who is a social worker at Eagler Warner and also part of the FEMA distribution team, are going to talk about. So Dr. Arnado is going to talk from the physician perspective about screening and appropriate pharmacology for women, during pregnancy and depression, anxiety. And then we're going to talk about more connecting to like the different resources in the community. And then our goal is hopefully we'll get approval to do continuing medical CMEs. I know that's important. And then to engage all the providers, like maybe the follow-up, if there's anything they're going to need to help with, like to make sure that their staff knows who they could connect mothers to for different programs that are in the community.
Okay. And what exactly is so the sponsorship, we are accepting 2,000 from.
So, and I mean, we haven't even applied yet, so this is just even saying like getting the permission to apply. So, so basically so far, because we have a separate grant with them already, but same thing, where like the money's already been appropriated, some of that money will go towards, just the cost. And then Notre Dame has donated the space to pay for that. So this would just be used to pay for related expenses, like CME, granting CMEs costs money. And
Like pamphlets? or-
yeah, right.
Okay, and
printing and
okay, and marketing and stuff like that, or?
but not so much marketing. I mean, we're gonna have invitations. What else? Don't have to pay for the venue, but we do have to pay for like some like security. Like the only thing we won't really be paying for is food, like that already. Oh, sponsorship, yeah. It's like the grant, like usually grants, you can't use that for food. So sponsorship can help pay for that.
Okay, yeah, okay. Wait, so this is the sponsorship, right?
This is,
So that can help pay for.
Any other questions or discussion? If not, entertain a motion.
I move to accept grant number 2311, the sponsorship from St. Joe Health System.
Second.
Motion and second. Any further discussion? All those in favor say aye.
Aye.
Opposed, same or nay. Motion carries. Next item on the agenda is public comment. So if anybody wanted to speak, please sign up or read our.
Can I ask one question before we go to public comment? Sure. Since this is this approval process is a new expectation from the commissioners, I think it would help our unit directors to know what the board wants this process to look like going forward. So will this just become kind of in the monthly meeting, we have the health officer report. Are we going to have an agenda item every month for approval of grant applications? And then what information do you all need to be able to vet those so that they can be acted on in a timely fashion at the regular month?
From my standpoint, yes would be the answer. Just a listing of applications that we'd like to go after. And I think this is like similar to what we have here, the criteria of the grant would satisfy me. That we just want to make sure that whatever we're going after is, falls under our mission and as part of our strategic initiatives. That would be what I would be looking for. And then on the approval side, same thing. If there's any strings that have been added to it or anything, we want to just make sure there's nothing onerous or that isn't under our mission.
The only other comment I would just want the board to be aware of, for instance, on the one of the grants that we've deferred, it doesn't necessarily lessen the amount of money that we can recover. But it does entail some cost in that because it hasn't been appropriated. We miss out on the opportunity to recover certain funds like travel to a conference that we'll have to pay for out of our budget and won't be able to put on the grant. And then it's time on the part of our staff to then rebudget that has to be submitted to the funder for approval and then to the council for appropriation. So there is cost, even though we can recoup the full amount, there is some real cost in terms of effort, personnel time to go through that allocation. Or through that rebudgeting process.
Understood. And the minute we heard of the issue, we called a special meeting to try and avoid all of that. And hopefully from here on out, we can avoid all that.
And we did request a schedule of all the grants and dates about when they're supposed to be applied for and when they're due and also, so we're working with the department to get a full overview so that things are not missed in the future. So I would say in response to your first question, I don't know if you guys have grants every month, if you do, then yes, and if not, if we can maybe group them or if we need a special meeting. There's so many, I mean, that, once we get that schedule, we will work on making sure that we're not.
Some are very predictable. The annual immunization grant, is pretty predictable when it comes up. There are certain kind of special funding opportunities that can be on a really short cycle. And those may be ones that we need to do a special meeting. But I think those are relatively few.
Can I ask Amy a quick question?
Sure.
Is this going to be doable? Like, are you going to be able to get into the cycle of this? Are people feeling like overwhelmed and stressed?
Well, currently, outside of the 4 that was on today's agenda and addressed, there are 14 more grants that are currently active within the department that are going to need approval by the Board of Health. So that can either be done, you can tell me how many you want on the next agenda, if you want to do them all, if you only want to do 4 at a time. But then I will also make priority the ones that are coming up that we are actually applying for. Those are obviously going to trump the ones that we currently have active. Now, we do have grants where we literally find out about it like a week before it's due. So we would definitely need a special meeting to be able to get that approval from the Board of Health before we apply for the grant. Otherwise, I would think it would be feasible to do it on a monthly schedule. I don't think the majority of them have such a short turnaround where we're notified of it and then the deadline is quickly approaching. All we can really do is try it out and see how it goes. And if we need to make changes as it goes along, I'll suggest those changes.
Thank
Work
you.
in progress.
Communication is important. I think open communication.
I agree with that.
Can I ask, I'm just curious, so you still, like, when you applied for grants before, you still had to apply, get the approval from the Board of Commissioners to apply? Is it
Correct.
just easier because the board meets weekly? Is that, you just, like, if you had a quick grant with a quick,
Weekly, yes.
sorry,
Yes,
commissioners meet weekly?
yes,
Yeah.
they meet weekly.
So it just, you just got it right onto the next agenda as soon as possible?
Correct.
Okay.
Correct.
And one more quick point of clarification, because somebody had asked about, is it possible? What's the rules or the law about somebody attending on Zoom and being able to vote? Is that a no-go from a non-starter?
So there was a meeting in May of 21. I think it was
21 or 22?
I don't remember. There was a board
It was
meeting,
22.
it's in the minutes, where the board decided, over Jonathan's objection, actually, to have everything in person. So that there is a policy that was voted on, that was approved, that was signed by Heidi, that in the event that there was an emergency or some other circumstances, we could go back. So the policy is in place if you guys want to go back to the hybrid meetings, but the board I can look up the date if you want, but
I remember talking about it, but I couldn't remember if it was just because of the COVID
yeah,
stuff.
John was the lone dissenter in the wanting to a hybrid meeting.
Only to make it easier for the public to give us comment.
Yeah,
That was my only reason. But right now, we're on a purely in-person basis
right.
for both public comment and board.
Would it be possible to allow hybrid meetings just for special meetings like this? The reason being that, we know our regular schedule, a regular board schedule, I mean, it's
Way in
set for the
advance.
year, but something like this, if we have to come in on short notice.
I think it would. The statutory requirements for the hybrid meetings are that you can only have so many, a percentage
Okay,
of versus your
Yeah.
regular meetings. That you must attend in person. So I don't think, as long as we got the regular meetings, people are attending in person, I don't think anyone would be in danger of violating that. So I think we could set that up if
Okay.
that's something that y'all wanted to vote on.
Well, we probably have to have a policy in place first before we,
The policy is in place for
Okay.
the hybrid meetings.
okay,
So it was drafted, it complies with the state statute, it's good to go. And like I said, Dr. Bidinger signed it as kind of a, if we need in the future, it's there. So I mean, you guys had some forethought when you did it. It was just at the time, the decision was made that all participation must be in person.
I don't think we contemplated that we might have situations where we might need to call special meetings as regularly as might now be the case, now that we're dealing with this grants more. My one hesitancy with changing the policy now is that I like to see it and see what the actual words say and know what it's gonna
I
say,
think Jennifer had.
but
You
maybe,
can hear from her.
yeah, or is that something we should add?
Added to the agenda to discuss.
Yeah, for the regular meeting.
I would think.
I mean, besides them, we actually would have everybody here, which would, including the people who can't be here because it's a special meeting, I'm gonna call it at
Right.
last minute.
Okay, we will add that to next month's, no, 2 weeks agenda. 15. That sounds good. It's a good idea.
Yeah.
Yep.
Anything else? Public comments next.
Cynthia Heckman Davis.
Do I need to read this
Yes.
statement that, yeah, all right. At our regular meetings, the public is invited to address the board for 3 minutes regarding items not posted or not posted on the agenda. Individuals may speak only once during the session, this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during the open session of the Board of Public Health. The board president may interrupt, warn, or terminate any person's statement if the statement becomes personally directed, abusive, obscene, or inflammatory.
Cynthia Heckman Davis. You knew I would speak. Cynthia Heckman
Looking
Davis,
forward to it.
Walkerton, Indiana. I'm sure that you're all a little disappointed that you had to have this meeting. You know, some states mandate that their departments of health do certain things like testing, TB testing, immunizations, the same things as required by ours. And those states fully fund their health departments. The state of Indiana doesn't fully fund those mandates by law that the department has to carry out. And so we're left with this hodgepodge of grants and by the way, Amy Rubin, total respect for all the grant writing that you do. Wow.
Oh, I don't do grant writing. I do it is not a big thing.
Yes.
It's all good.
And we're left with Department of Health personnel always wondering, are they going to be funded? What programs are going to be funded? I think that the Board of Health really has an opportunity here to plan this out better than it has been in the past. That you can be financially responsible and use all of your creativity in order to sustainably fund our local Department of Health. You know, I think that's very important. And with the goal of being efficient and nimble. There are always going to be unforeseen things come up, but I really like the idea of having grants talked about regularly at Board of Health rather than a big dump of grants at one time. I think that'll be good. There will always be unforeseen things come up. I was reading in JAMA about a study done in 2 Philadelphia hospitals. It was testing women in labor to see whether they were immune to measles or not. And that study found that only 4 in 5 were immune to measles, 1 in 5 not immune to measles. And we're seeing some measles cases in New York. That this is something that might come back. There are always going to be things that are coming up for something like the Board of Health. But we also know that a healthy community is going to be more economically successful, financially successful. If you've got a healthy community, you're going to have more opportunities. So I
would ask that the Board of Health here just keep hanging in there and try to get things right for the Department of Health.
Thank you.
Taylor Coates. Hi, Taylor Coates, South Bend, Indiana. A resident of South Bend, Indiana. I want to start by saying thank you for meeting today. Once again, special meetings aren't fun. I know what it's like when you get popped up and you're like, oh, all of a sudden I have a meeting that I have to hold. It's essential for the well-being of a group. And your job is so difficult because you're overseeing the entire county and the health and well-being of the people who live here, but also the safety of the people who live here. So I do not envy having to go over all of our grants that the folks of the department write. But I do notice two things. One, it's clear that there's maybe a lack of understanding or experience within the grant writing space from many on our board. That is okay, right? That's why some people are specifically grant writers and those aren't. But I do encourage the board members to take time to go through the process, maybe take a training course. There's some at the national level of grant writing courses that you can take. One's a 2-day training. I just completed it myself. And it would be really great for you to see the inside of what it looks like to go through the process, what it looks like to apply for the grant, what it looks like to hunt for grants, going through the websites themselves and learning how to shift through them. It's really hard to approve something when you don't fully understand the amount of work that goes in behind it. Right. That's why the special meetings are going to be so important when new grants pop up that we want to take. Sometimes they're an hour or you get a month to take them. Sorry, 1 month to take them. And so just kind of going through that process could be a really good learning experience. I encourage you guys to maybe take part in some of those. And Notre Dame also has some grant writing courses that you can take that are just open to the public, 1 or 2 days seminars that would help you understand the process a little bit better. And then the second part, I think for people in the department, it might be really beneficial to know what type of grants you are and are not willing to fund. So giving us a head sight of what interest topics are you more likely to lean towards, and what areas do you prefer that the Department of Health stay away from? If it's clear and in writing, people can navigate through that. But if it's the assumption of maybe or maybe not, it's a lot of time for you to be pulled together just to say, this is not something I'm willing to fund. So the community as a whole, residents like myself could have in writing what type of things you're interested in seeing the Department of Health head towards, and what grants you are interested in them partaking in, and what current grants that we have as a Department of Health that you are interested in continuing to fund. It'll give everybody in the community a better idea of where you're headed and where the Department of Health is headed as you are our Syrian head. So that's all I have. Thank you, guys.
Thank you.
Robin Vida, South Bend, Indiana. Just want to address 2 things that were kind of passed around here in a minute, a little bit ago. The Department of Health, as a unit director, writing grants for almost the last 16 years here. We never write a grant thinking we're not going to receive it, period. Like, we write it because we want to put our time and effort into receiving that grant, and most times feel that we will receive that grant. Also, I think we really need to rally in the success of our department and the grant writing. Several of our grants, we are one of a handful in the country that have received these grants. And the other thing to Dr. Migliori's question about is this stressful? Yes, it has been. We have grants that are waiting to be heard that mess with people's salaries, their livelihood, whether or not they'll have a job next. Prior to Dr. Einhurst, most of our staff were grant written. So kudos to him for coming in and having some financial sustainability and pushing us as directors to go for that external funding to support the efforts that we knew would have the greatest impact on the overall health and well-being of our community. Also extremely stressful to be prepared to go to a meeting and then be cut off or denied or reprimanded for not having prior approval, when in our minds that prior approval had been done the way in which we had been instructed to do it. So I think that's the stickiest point, because that makes then us as a Department of Health look untrustworthy, a little bit like we're trying to be sneaky, not follow the rules. And that, as a person, a public health professional, and as a person who for the last gosh, almost 2 decades of my life here in this community has worked really, really hard to work on our image and our credibility. I take personal offense to that. And we are good working people who love our job, who would stay probably throughout our career. However, being shot down time and time and time again, and then not have someone come to our aid or to our benefit or to stand up and say, wait, no, this isn't on them, feels kind of like a slap in the face. And it's just unfortunate and disappointing. I'm hopeful as we develop a process moving forward, we'll have less of those instances. But I do find it hard to believe that grants that have been written for, contracts have been signed, they've been executed, people have been hired, we've been doing the work for years, now need to go back through. That's
Thank you.
all.
Understood. That's it. Okay,
Can I say just one real quick thing?
sure.
I would personally like to thank all of you who do the grants because I know it's incredibly very, very hard work. And unless you do grants, like you said, you don't know and you don't, it's very, and if you feel like your job depends upon it. So I personally appreciate all of your hard work and I'm really sorry if you guys have been sucked into a system that maybe wasn't well-oiled or wasn't running the way it was meant to, or where the way people thought it was, and you were just trying to do your jobs. And I think we're all human beings and we all want to have happy, healthy families and have job security, and to feel like, you know, you're under the gun, that's a terrible feeling. And I'm sorry for that. And I hope that going forward, the Board of Health can be very transparent and say, look, these are the rules we have to follow. And not make it feel like you're being accused, because that's not, if you have no control over that, then how can we accuse you for it?
Well said, thanks.
Thank you.
Next item is our time and place of our next regular meeting will be March 15th at 4:30 in this very room. I'll entertain a motion to adjourn.
I guess I'll move to adjourn the public portion of the meeting.
Second,
Pardon, it's two different meetings. I'll move
Different
to
meetings.
adjourn the meeting.
second.
All those in favor say aye.
Aye.
Opposed? Okay. We're adjourned.
Thank you.
Thank you all.
Thank you.
It's my cousin's birthday today. I got to text her. I don't know how I missed it. Busy day, I guess.